Hi, my name is Irene McEwen. I am a student at Mohawk College in Hamilton. Today I am sharing a program that I wrote and implemented with a student that receives intensive behavioral intervention at the agency where I am completing my field placement. My program is teaching intraverbals to a child with autism. What are intraverbals? Intraverbal, a verbal response to another person's verbal stimulus that does not have point-to-point correspondence. What the heck does that mean? Basically, all it means is that you are answering a statement or a question that another person has posed, and it does not match what they said. For example, you're not echoing the exact words as if I said show and the child said show. You would be more like, what are you doing? And the answer being, I'm playing with my toys. The client profile. The child is a 7-year-old male. He's been diagnosed with autism spectrum disorder. He attends school in the morning and IBI in the afternoon. He is high functioning. He is at the high functioning end of the spectrum, is verbal, and has minimal behavioral issues. He does have learning difficulties in math and reading, but social skills are his main area of deficit. For example, initiating conversation and social interactions. He enjoys gym and Lego and asking the instructor therapist to do silly things like pretending to fall asleep. Rationale. Why teach intraverbals? To help build social skills by allowing for the development of conversational skills. Intraverbals play a central role in the acquisition of academic and social skills, so that a child can meaningfully respond to the language of others. Prerequisites. There are several skills that are needed before teaching intraverbals. Some of these are strong manding and tacting skills. Manding just meaning making requests, and tacting meaning labeling items. You need good receptive language skills, which is listening and understanding language. Identification of items by feature, function, and class. For example, what is yellow, carries a lot of kids, and is a type of vehicle? The answer, a school bus. Attainment of other basic and lower level intraverbals, that is fill in the blanks, simple associations, steps and sequence of daily activities, answering personal questions, and then asking the where, what, who, which, why, when, how questions. The program is the ABLES revised H29 intraverbal when question. ABLE is the assessment for basic learning and language skills. The objective is the student will be able to answer when questions in and out of context across a variety of therapists, peers, and his parents, and across settings at the center, home, and in the community. The child will be sitting at the table with the therapist or in net, and underneath here we have an example of what net might look like. It's natural environment teaching, so basically you are teaching in a natural context for the child, like for example when they're playing. Materials include the visual prompts, which could be any kind of drawing or Google image or clip art that's mounted on recipe cards. The ABLES mastery criteria is that the child will answer 50 or more when questions. For baseline, I compiled 50 when questions and then ran 3 baseline trials. So myself and 2 other ITs ran the trials, and then the percentage correct for each trial was calculated and is displayed in the graph below. So as you can see, the results were quite high. Usually in baseline you would expect that they wouldn't get this many correct. But this particular student is near the end of his time here. He has acquired most of the skills in ABLES. So this is a program where he does have some good skills already, but 100% for 50 questions is the mastery criteria, so there is room for improvement. The acquisition phase, the antecedent is you would ask the when question and then present the visual immediately after. For example, you'd ask a question such as, when does Santa come? And then immediately show the picture. The procedures are, you would have 3 questions in acquisition at a time. These are called targets. So the 3 targets would be 3 questions. You'd begin with baseline questions scoring at 67, then 33, and then 0%. And the reason for this is you want your child to have initial success immediately, so you're starting with the easier questions. If the child has difficulty answering correctly using the visual prompts, verbal prompts may be introduced and faded following the prompt fading procedure. This would probably not be necessary with this child because most of what he acquires, most of the skills, he does in one trial. The behavior for the child that you want to see is that they'll respond independently with an appropriate response, and that just means you're not using any prompts. You just ask the question and he responds. Reinforcement, all correct independent acquisition trials are reinforced on an FR1 schedule, which means that each time they respond correctly, they would receive reinforcement. To move to the next step, the child will provide the correct response independently on 3 consecutive trials followed by 1 cold probe across at least 2 therapists over 4 sessions. So basically this means 4 times in a row, the child's going to answer you independently with no assistance from prompts. Prompt fading. The visual should first be presented for 3 to 5 seconds, faded to 1 to 2 seconds, followed by no prompt. Prompts are faded on back-to-back trials whenever the child is successful at the previous prompt level. Should you need to use verbal prompts, you would fade them. You would first start most to least, so you're giving them the most verbal prompt to begin with, which is providing the full response immediately following the question. And then to fade that, you would provide only part of the response and then no prompt at all. For data collection, the data is recorded on session notes during the session, and then at the end of each session, data was transferred to a cold probe acquisition data sheet, and there is a picture of a sample below here. So you have 3 choices: teaching trial, yes or no, for each one of the targets. And for the 3 targets that I started with were, when do you wear a hat and mittens, when does Santa come, and when do you eat breakfast? So as you can see, one of these is circled for each session. The prompt level that was used when doing the cold probe is also indicated, and here the I stands for independent. Data presentation. The IT records the mastered targets for the program on a cumulative graph at the end of each week. So this graph is actually hypothetical data. Unfortunately, because data is only recorded at the end of each week, and the child was only here for probably only 4 sessions because just unexpectedly, he is attending fewer times. So based on his history, the program would be very successful with this child because in every time he responds and learns the skill after each teaching trial. Generalization and maintenance. Excuse me, I'm just going to take a quick drink. Generalization is important because this means that the child can acquire the skills and show that he knows how to do the skills outside of the clinical learning environment. So, generalization will occur by asking 5 novel questions during NET across 5 different settings, including at home and in the community, and across 5 different peers and therapists. Maintenance is required just to make sure that the child doesn't forget the skills and that over time he will still be able to display that he knows these skills. Maintenance targets should be run for 3 consecutive days, then 3 consecutive weeks, and then finally 3 consecutive months. If a child receives 2 consecutive incorrect responses, this should be brought to the attention of the senior therapist. The target should move back a level for that target or program. So for example, if the child was running maintenance for 3 consecutive days and made 2 mistakes in a row, this would have to be moved back into the acquisition phase. Research evidence. Goldsmith, LeBlanc, and Sauter in 2000 did a study with 4 12-year-old children with autism who had minimal compliance issues. They were taught TACs, then Intraverbals, with picture prompts using a transfer of stimulus control procedure. After TAC training, TAC repertoires increased significantly, while Intraverbal repertoires did not change. So this supports the premise that verbal operants such as TACs and Intraverbals are functionally independent. In other words, teaching TACs and knowing TACs does not necessarily lead to learning their intraverbal skills. They need to be taught. The results of this study indicate good acquisition effects. The second study, Ingverson, 2011, compared the efficacy of using picture prompts with verbal prompts in establishing intraverbal responding. 3 4-year-old boys with autism took place in this study. 32 questions were presented using both types of prompts. The pretest conducted to ensure children could label pictures and echo verbal prompts. Prompts were presented immediately following each when question. Both the prompting tactics, both verbal and picture prompts, were effective, but children reached the mastery criteria in fewer trials in the picture prompt condition. So based on both of these studies, they both support using picture prompts to teach interverbals. These are my references. Just leave that there for a sec. So I just wanted to take a moment to thank everyone. Many thanks and much appreciation to the instructor therapists and senior therapists, as well as members of the ABA team for your patience and knowledge sharing throughout this placement. Could not have done this without you. Also thanks to all the professors at Mohawk College for preparing me well with the tremendous amounts of knowledge acquired throughout the year, which will now make a career in ABA possible. I just want to also thank my recorder, Ali White, and ciao for now.